there, I'm Professor Muellinghaus. I teach anatomy and physiology for the past 12 years. But besides that, I'm also a chiropractic physician, and as such, I've been having the great fortune to work with Bill Romanowski for the past decade or so. And Bill's claim to fame is that he played football for over 17 and a half years without ever missing a game. And through that process, he's got a lot of experience in figuring out which techniques work well and which don't work well. And through that, I've of course been able to learn and been learning techniques that worked really well for him. And so besides him, I've also been able to use those on football players such as Christian McCaffrey or Amari Cooper, as well as Bryce Butler and a few more. But what's most important to me is to adapt them enough that we can use them on the general population, and as such, particularly on the geriatric population. And I have a testimonial following. I wanted to meet Miss Ines, and she's 89 years old, and she's had pain in the inner thigh for strong enough that she has to use a walker to get around, and within a few visits we've been able to help her. So let's listen to her and then we'll come back. So there we go. Hi.
You want me to put on lipstick?
No. Yeah, sure, if you want.
Yes, sir.
What? Hi.
Hi.
How did you help? What did you come in with?
I came in with severe thigh muscle problems, pain.
Okay.
A lot of pain. I could hardly walk without a cane or a walker, and I was in constant pain.
And it was shooting down, right? Down the thigh?
Shooting down my thigh.
Okay.
And making it very difficult to get around, even to get in and out of the car was painful.
Okay. And then what did we do? How did we help you? What did you feel like we helped you with?
Dr. Muellinghaus used some muscle therapy on me, and gradually it has really improved to the point now where I have no pain.
And about how many visits do you think it would take us? We did weekly, right? We did a weekly for 3 visits?
5 or 6 visits.
5 or 6 altogether?
5 or 6 visits, yes.
Good. And it's been holding? It's been better, right? It's been consistently better.
The last couple days, I've had no pain at all. It's been sore, but the soreness seems to have dissipated.
Good, good. And are you able to move better?
I'm moving around without the cane.
Good.
Which I wasn't able to do before.
Good.
And I'm very grateful.
So what we did with Miss Enith is she had pain right in here in the thigh. And as a chiropractor, we work on the joint structures. We look at those particularly, of course. But then we also go into the muscle. And we can look at a muscle perspective from like a pain perspective, but also a functional perspective. Which muscle fires or which muscle doesn't fire well? Which muscle is not talking to the brain properly? And so with Miss Ines, we found that the pectineus, which is a muscle right here, doing here, but particularly the gracilis, which comes from down in here to the inner thigh, those were not working well, and those gave her pain, especially in the places where they anchor into the bone. And so we've done a specific technique that works on the attachment sites, but also uses different reflex points, and the muscle gets reactivated and reinvigorated. And it was strong enough, even at 89, that we could do that she could then walk again without a walker. And that's what did the biggest difference, in my opinion, in her treatment. All right, thank you for listening.